Like these days, we are always on the go, barely at home, and certainly if you have to undergo any sort of orthopedic surgery, odds are you'd want to recover in the comfort of your own home.
Yes, absolutely. And at UC Health, you actually have the option to do just that and still receive quality care every step of the way. So that sounds awesome. Now, Dr. Branam tells us more.
At UC Health, the patient comes first. We want to provide the best quality care to the patient that we can provide. There are lots of orthopedic providers in the city. There are a few things that set UC Health apart. First and foremost, we're the only adult academic medical center in the region. To that end, it is our job to train the next generation of clinicians. In order to do that, we must be up to date on the most recent research and technologies that allow our patients to rehab the fastest. However, the most significant change right now is that we're shifting many of our surgeries to the outpatient setting. The patient has surgery and goes home a few hours later. To that end, we're converting the Westchester Surgical Hospital into an orthopedic-only venue. We can shift these traditionally inpatient surgeries to the outpatient setting because of advances in medical and surgical technologies. It is our job to be the go-to for the most complex problems. It does not mean that we cannot take care of the most simple problems in our friends and neighbors, with problems like arthritis, ankle sprains, or any problem that they have. Patients want to recover at home. They do best in their own environment where they can recover and get back to work and doing the things that they like to do. Not every patient that has surgery at the hospital needs to stay overnight. We can and do outpatient surgeries at the hospital. It just gives us the option to admit that patient should the need arise. Having said that, 100% of the patients that I do here at the Westchester Surgery Center go home the same day. They go home within hours of having their joint replaced. Those patients are pre-identified prior to surgery as candidates who do very well at home. First and foremost, candidates for outpatient joint replacement have to be patients that desire to go home the same day. In order to have a successful outcome, you have to be committed to the postoperative rehab, doing those in an outpatient setting. Additionally, patients have to have the support mechanism to be successful. Somebody has to stay with them for the first 24 hours. After that 24 hours, that support system also has to be able to get them to their postoperative appointments. The better and better we get at doing outpatient joint replacements, at doing it safely, we can do the higher acuity patient with more complex medical problems as an outpatient as well. The patients that go home have 24/7 access to an entire care team, and via that, they have access to our subspecialists as well. The entire process is streamlined, from pre-op to intra-op to post-op. We provide quality, collaborative care every step of the way.
And for more information about outpatient joint replacement at the University of Cincinnati, call them at 513-475-8690.